Guest on the show this week is the Vice President of Population Health for Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Welcome back, Courtland.
Thank you.
We are looking at a report from your labs in Detroit. The Department of Pathology and Laboratory Medicine last week administered their 1 millionth PCR COVID test.
Yeah.
1 million. Remember the first week, people were waiting in line in their cars to get a test and then waiting like 2 weeks for the results.
So we, to actually, that day, so President Trump at the time declared a national emergency on Friday the 13th of March, 2020. And we had a team that stayed up all night, actually, that night on Friday. And we set up that drive-through testing site. And so we had the drive-through testing running by about 10 o'clock in the morning the next day. But yeah, none of the sort of back end was ready yet to handle the influx of tests. And so it took about a week or two to get all the results back.
Pretty amazing too, because it was your lab, your folks that continued working on getting a test that could be administered quickly, and the results could be available right away.
That's right. Yeah, that's right. There's a lot of like really cool stories, I think, from that period of time. And the lab has been one of the groups that stepped up, I think, in a tremendous way to be able to process those tests. So we actually very early on, we partnered here locally with the Garsha lab. And they were ready to go before many other labs in the country. And they helped with processing those tests in the very beginning. And we were getting results back within days, right at the beginning, when it took everybody else, 2 weeks. So.
Yeah, you're right. There are going to be stories. There were some tragedies, stories, of course, but ones that you can kind of laugh about now. I remember here at JTV we got calls from people frantic. They couldn't find toilet paper. I remember one call in particular, couldn't find Clorox wipes, and they needed them to wipe down their boxes of Triscuits and cereal.
Yeah.
We didn't know, but we didn't know what we didn't know.
Yeah.
So where are we today as far as COVID?
So numbers now look very promising. The summer months, we've really seen things trail off. There's a handful of people at any time that are hospitalized with COVID, but they're very low numbers. The wastewater data, which tracks the amount of COVID genetic material in the wastewater in Jackson, is very low. So that's very promising. And hopefully things kind of stay that way as we swing into the fall and people are inside more. I think we'll end up with, it was about a month or so ago now that the FDA said that they're going to steer towards having a single valent vaccine that is really targeting the newer variants, not the older variants we used to have, and that's going to be, it looks like a single shot. So it's going to be a once a year, very similar to a flu shot that we're going to see and expect. And the companies that manufacture the vaccines they're making them now, right? I mean, they're working on making those vaccines now, so they're available in September, October.
So people are still getting COVID, but very, very few. But we're on top of one another now. We're not wearing masks. Look at this past weekend. We're on top of one another.
Yeah, there's less of it circulating. There's a lot more immunity in the environment. People have been vaccinated. People have gotten it, and so it doesn't spread as readily as it used to, given the levels of immunity that we have in the environment. So that's been very good. And I do think people are a lot more careful. I was on a plane this weekend. There's still people that wear masks on planes, and I think you observe people doing a lot more hand washing and maybe just subconsciously social distance and aren't quite as close. And so I think there has been behavioral change that's been a little bit lasting out of this. It hasn't just been that we had the vaccines or people are have immunity. I think behaviors have changed.
Is it possible there are people, for whatever reason, they just are immune, they weren't immune because they were exposed. They're just not susceptible to getting certain things.
Probably not. Probably not if they everybody has that receptor on the cells that lets COVID in. It's an ACE2 receptor. They'd have other problems if they didn't have that receptor. So I think everybody's pretty susceptible to it. There's different levels of, I think, immune function. So some people will get sicker than others. Some people's, I think, natural immunity, not to COVID specifically, but I think their immune system, you're more likely to get sick if you're compromised in other ways than if you're just, sort of a young, healthy person.
It's possible people did get COVID, but they didn't even know it.
That is true. Yeah, that is true. There's a lot of those. I mean, a lot of people will get a cold and didn't think it was COVID and didn't get a test, so they don't know. But if you did antibody testing, they would see they have antibodies.
Mm-hmm.
Yeah.
Yeah, we were turned into scientists. We all had the mixing the water, the chemicals.
To do their antigen test.
These Chinese test kits, we trusted them. All right, well, so long COVID though, that's still the mystery, and we don't know, and we probably won't for a long time, what long-term COVID is going to be like for people.
I mean, there's the data shows that anywhere between 10 and 30% of people that have had COVID develop long COVID symptoms, so symptoms that last for more than 8 weeks. We're still learning about the condition because there's so many different types of manifestations. Some people lose their taste and smell for a long period of time, and that's long COVID. The thing people complain more about is the fatigue and the aches and mental fog, and the reasons why people get that is not really clear. But it's probably multifactorial. There's more than one explanation for why that's happening.
It reminds me of Lyme disease in a lot of ways.
In a lot of ways, yeah. It's a very different virus than, it affects the epithelial cells. We have epithelial cells all over our bodies, the lungs, and in other places. And so people get symptoms that are much more sort of, I think, kind of non-specific and also systemic than they do with like the flu. So it just behaves differently, and we're going to continue to, I think, learn more about some of these. But it's different. It's different than a lot of other viruses we faced in that way.
So with the vaccine, you could go right now to your doctor, pharmacy, and get a COVID vaccine. But there's something coming in the fall that's different.
Yeah.
That's more universal. Yeah. So should we wait
if somebody has gotten no vaccines yet, I would still say go get a vaccine. If you've been vaccinated already, I think you've gotten some amount of vaccine in your system at some point. I would probably wait at this point until the new version comes out.
Our summer, in addition to all the usual summer things, water safety, fireworks, heat, we've got some new this year, air quality. We've got air quality alerts. We can see smoke in the air. How concerned should we be?
So I think that's a really good question, and I don't remember. I mean, I grew up in Michigan. I don't remember anything like this in the past where we had air quality like this, and so what people might, think is interesting is, so the EPA through the Clean Air Act regulates six air pollutants. They're called 6 criterion pollutants, and so there's things people might expect. So like carbon monoxide is on the list, ozone is on the list, things that get monitored, but also sulfur dioxides, nitrogen dioxides, particulates, and there's PM. Particulates are called PMs, and there's 2.5 and 10. 2.5, and this is in micrometers, so very small measurements. A human hair is 75 micrometers or micrometers, and we're measuring 2.5 and 10, so much smaller than even a human hair in size. Fire is what's driving the most of those. Lead is actually the 6th one, which is kind of a throwback to the 70s when they started to monitor, and that's when they took lead out of gasoline. So yeah, everybody's IQ that was born before the 70s is probably about 5 points lower
Because of the lead.
because of lead that was in gasoline. Yeah, so that's actually been one of probably the greatest successes of public health in the last 50 years is the regulation of lead. We've really noticed it now in obviously drinking water with Flint, and we've seen in other places. There's other cities that have even higher than Flint that wasn't quite as high profile, but the impact of lead on the developing brain and neurologic system is pretty profound. So anyway, so that's sort of a sidetrack, but that's been a success. That it used to be that lead was a really significant air pollutant, and really is no longer the case because of legislation and taking it out of gasoline. But it leaves us with the other things. We still have carbon monoxide, the particulates, sulfur and nitrogen dioxides, and ozones that are very prevalent, depending on the parts of the country you're in, and it is the air quality index is actually based on all of those things. And so there's about 40 air quality monitoring stations in Michigan kind of spread out around the state. And they sample pretty continuously, like 24 hours a day, each of those particulates from the air. And that's how they come up with those numbers that we see, right, that index to help warn people, if, sensitive group or not, even when you have not
People with
sensitive groups.
asthma, something like that.
Yeah, so once that index gets up, so less than 50 is really considered good air quality where everybody should be safe outside. Once it gets over 50, some people very sensitive may have issues in the 50 to 100. Once it's over 100, the index starts to become more problematic, especially for people that have asthma, COPD, and other lung or cardiac conditions can have more trouble. The forest fires, which I think is really kind of the newest thing, and this is where we're actually seeing the impact. This is the impact of climate change. I mean, people kind of debate that, but the climate is changing, and the forest fires are part of that. The forests are drier, they're more likely to burn, and we see the Western U.S. has dealt with this for a long time, right? In places like Utah, Nevada, Idaho, they get the effects of the California wildfires every summer. But now that we're seeing it here from Canada and other parts, more to the east, and it's the PM 2.5s and 10s that come from the burning. They're the issue, and a PM 2.5 is small enough to get into the bloodstream, so you can actually inhale it. It gets into the lungs, is absorbed, and then is in the blood. So we're essentially inhaling smoke that then distributes throughout the body. So it's irritating for a variety of groups of people.
So when we were kids, you're too young. Smoke came out of every car all the time, summer or winter. Every car all the time. Smoke was just billowing out the back of every car, and that obviously contained lead, but a lot of other irritants, and that's why we're dumber. Older people like me are dumber because of the pollution. There's good published data that people lost IQ points before the 70s. All right, real quick, one quick thing we want to talk about. The ER, Jackson has a record-setting ER, and that's not a good thing.
Yeah. So both the ER and the hospital, and this goes back to the COVID conversation. So what we saw is we've actually seen ER use go down over time in this community, which has been a good thing. And then during COVID, the hospital use went way down. And this happened all across the country. We saw that hospital use went way down for things that weren't COVID, right? So we saw less people coming in with other types of conditions to the hospital. Hospitals were still pretty full, but it was with people with COVID. And we also saw here specifically that death rates from non-COVID conditions didn't change a whole lot. It's not like all of a sudden we had huge numbers of people dying from strokes and heart attacks and other things. So what that says is people tended to still go to the hospital when they had really significant problems that needed to be addressed. Now that COVID has really ended and people have kind of come out of their sequestration and their shells, so to speak, we see the hospital use going up again, right? The emergency department and the hospital use. And so And so when you compare us in Jackson to other parts of the state and across the country, we tend to go to the ER more than pretty much everyone else. We're pretty much the bottom within the sort of lowest 10th percentile of go to the ER. And there's a variety of reasons probably for that. But I think it's important to make sure that in the community people are really kind of using the appropriate level of care that's going to help them really get the best outcome, right? Like, this is why a primary care doctor relationship is so important, because if you have an issue, you can call your doctor and say, hey, this is what's going on, and they can help manage that, so you don't have to go to the hospital if something can be managed in that setting. And for a lot of folks that don't have primary care docs, which there still are plenty of those, there's other urgent care and walk-in type settings where they can be seen. There's an urgent care right across the street from the hospital, the IEP urgent care. Center for Family Health has a walk-in clinic that's open every single day of the week. As two examples, right? So there's lots of other opportunities that if you can't get in to see your doctor right away, there's other less acute settings where you can still get care. For the kid that has the ear infection, or for the low back pain, or things that may not be quite as much emergencies or as life-threatening.
And that non-emergency use of the ER is clogging the ER,
does.
so people aren't getting care as fast as
It does, and we still struggle with, in a significant way, staffing challenges post-COVID, right? Because the fact of the matter is a lot of people in healthcare, physicians, nurses, techs, a lot of people, supplying the workforce has been hard. People burned out, it's been stressful, and that's still lingering, right? COVID is over, the pandemic ended, but we have still a lot of stress on the workforce. So when we have a lot of things that go to the ER, for instance, that could be handled by a primary care doctor who somebody has a relationship with, it puts more stress on those systems. And we want those systems there for people that have the more severe diseases, right? So if somebody comes in and they're having their heart failure exacerbation, or their heart attack, or they're having a stroke, right, we want to be able to take care of those people. Or a surgical problem, right, that needs the expertise of a surgeon emergently. And take care of the things we can take care of in a different place, in that setting that's lower acuity.
And I'll add one more piece of advice to those who visit the ER. Do not yell and scream at the providers. It will not help.
That doesn't help usually. No. Yeah, that's good advice.
Yes. All right. Thanks for coming in. Good to see you.
Yeah.
VP of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Up next,